for oncology nurses who are caring for patients with blood cancer, I think there are three main things that you can think about. Number one, listen to the patient and the caregiver. That was the most important thing. Sounds like I talk a lot because I do, but I also tried to be a very good listener. That is one of the reasons why nurses, I think, are the number one trusted healthcare partners as part of the treating team, is because they listen and try to listen with empathy. You don't know what they're going through at home. You might think you understand, but nobody knows what anybody is going through. So listen with empathy is number one. Number two is try to gather the information through that listening actively and decide what kind of information that person needs to help them take control of their care. Patients are their own primary care providers, right? Because they're with themselves, the caregivers are with them if they have a caregiver. Quite frequently. And so we need to be able to give them information to where they're at, whether it's electronic information through the internet or printed on paper. Maybe they're not tech savvy. And then the number three thing they can do is be a member of the healthcare team. So there's no INT is what I'm always saying. So the physicians tend to be the number one that recommends the treatment. Advanced practice providers like myself are on par in many cases by recommending treatments, diagnosing and prescribing these blood cancer treatments as well. And then the nurses can be that critical link that can share information that maybe the patient and the caregiver are more comfortable sharing with that nurse and not necessarily the provider such as the APP or the physician. And so again, those three things are super important, I think, is, the active listening with empathy, determining what informational needs they might need or support needs, and then being that member of that healthcare team to mutually share information. It kind of goes along with the shared decision-making that I'm so passionate about when we're providing care to patients. So I think the nurses are very well educated and well suited to fit the patient's needs and be that member of the team.